You know we want to see each other. We'll have to stay in your quarantine space while we talk.
All right, welcome to Quarantime, and this is our fourth edition. It's a show that started a little over 2 weeks ago, and if you've been following us, you know that what we became interested in is all of the innovation activity, the deep science, the way that the activists and communities are responding, the social response in all of this. Our first episode focused on the whole world of synthetic biology with Andrew Hessel. How was that responding? We spent one on bottom-up response. We called it the Commander is Us, and we looked at how this responding movement, because at a time of so much going on in so many places, you can't just wait for top-down things. Lots of experiments have to happen. In our last episode, we got into this whole question of long-term versus short-term thinking, crisis response versus how are things going to change. And the fact that, as Alexander Rose told us from the Long Now Foundation, in many ways, not being prepared for a pandemic is a failure of long-term thinking. On today's show, we want to get into some of the portions of our global systems that we think really are going to change after this. A lot of the articles this week have been starting to focus on that. You know, it's an old saw that after a crisis, people say everything changes. Healthcare system's going to change, kind of finally make the economy more even. We're going to have to deal with and bring about big changes. And there's another school of thought that says, no, people are normal. Things won't get changed. That's almost the Bernie versus Biden argument going on. And there's an argument that says, in a way, we'll go backwards. There'll be so little funds available that the public works that we want to do or the investments that we want to make might not be there. And it's kind of vexing to think through what will this leave as permanent and hopefully productive change. That's the theme of today's show. And one of the most interesting things about putting this together is as we start talking to guests, seeing how these themes come together. Today we'll be talking to Susan Dentzer, who's one of the nation's top experts on what some people call telehealth. She calls it medicine without walls. This is the whole bit of being able to diagnose and provide treatment without people going to the hospital. This was something that for years policymakers and payers resisted, and all at once, suddenly it's important. And Susan has an incredible view into the changes that may come, how technology will play a role, how this leads to both investment opportunities, but also changes, almost a logjam break. We'll talk to Marco Annunziata, who is the former chief economist of General Electric, an Italian by background, one of the world's foremost economists, on just how do you put an economy back together? Does this look like a post-war situation? Is this a sharp V curve? What do we have to look out for? How do we stitch things together? And where are the weaknesses? And then we'll talk to Ted Linhart at NBC. For TV networks that have watched years of audience decline, this has been an incredible moment of an audience spike, and networks are trying to figure out, is this an experiment for future behavior? How do they get audiences? What are they learning at a time of such change? Kind of fascinating over there, including TV networks are now doing cheaper production values, the same kind of stuff we're doing here. If you followed like the Colbert Show, what does this mean for unions? What does this mean for the cost of doing something like that? So all of these system change issues are some of the things we'll talk about today. And as always on this project, we have my co-host and fellow traveler in all this, Mickey McManus. Hi, Mickey.
Hey, Peter. How you doing this morning?
Good.
Can you hear me? Yeah.
One of the things we want to point out, I can hear you perfectly. And one of the things we want to point out before we go to our first guest is what we're doing here is part broadcast, part community. So if you're looking at this on Facebook or LinkedIn or YouTube, your comments channels should kind of engage with you. And on our team was helping to pull that together. But also, we want this to be community. So, Mickey, you started from the very first show, our community whiteboard. So why don't you talk to us a little bit about what we're up to here, how people can tune into this, and how this has really become a running conversation of collaboration across these shows.
Yeah, I mean, we're trying to experiment with how do we have kind of shared cognition. And one of the things that we know is that leaders who draw together think together, and people who work together, if you just grab a whiteboard and say, hey, draw what you mean, people can do that. So you'll see that I've got just this open whiteboard. Today's episode will be here, but we have last episode from last Wednesday and Friday over there. And you'll notice that there's also sort of, I'm starting to compile a little bit more with sort of book reviews and further reading and things like that over here with some links. So some of the books that have been talked about in the past: Palaces for the People, Skin in the Game, Noman, The Maker City Playbook by Peter and friends, The Splendid and the Vile by Eric Larson. Each episode we try to also just capture what's going on there. And this is a infinite persistent whiteboard. It's one of those things that I'm just experimenting with. I didn't even know about 2 weeks ago, and I'm playing with. I think everyone is trying out new ways of doing things, and how do we get past, just the talking heads on a Zoom call or a Skype call or something like that, and actually work together. And so this is one of the tools I'm experimenting with, and that's where I'll just be capturing this. And we're hoping that in the future we'll just have other people drawing too, so that we can all draw at the same time. This particular product seems to allow us to actually have collaborative drawing as well. So that's the idea.
That's great. I think we'll start today with Marco. So Marco, welcome to Quarantine. And here we go. There we
Thanks,
go.
Peter. Thanks,
Hi
Peter.
there.
Hi, Peter. Hi, Mick.
Marco, how you
hi.
doing?
Marco, you are an economist, and you have been writing a lot about both some of the data failures that may be leading to poor decisions here, and also we've had conversations about how does the economy come back after this. So why don't you talk a little bit about your perspective and some of the things that you've written, and then I want to kind of get into this whole bit about how do we plan and what does comeback look like? Does this look like a post-war situation? Will these stimuluses work? On a very microeconomic basis, this is the week. Today is April 1st, a day that rent and utilities are due. So we're going to see an awful lot of potential economic fallout turn into actual economic fallout this week.
Absolutely. As you mentioned, Peter, the key question right now is what is happening to the economy, or rather, let me say the key question for economists like me, beyond and besides the human toll that the coronavirus outbreak is taking, is what is happening to the economy? How do we get out of this, and what kind of economic recovery can we hope for once this crisis is over? And as you mentioned, I've actually spent quite a lot of time looking at the numbers on the coronavirus outbreak itself for the following reason. I think the extent of the damage that the economy will suffer, and therefore the kind of economic recovery we can hope for afterwards, strongly depends on when we can go back to business, when we can start bringing economic activity back to normal. And that in turn depends very much on how the outbreak plays out. I have been concerned because I have seen first a wide range of forecasts on the potential damage of the epidemic from a human standpoint, with projections you've seen for the US itself, where the models are apparently saying the death toll could range from 100,000 or less to more than 2 million. The length of the shutdown, with some epidemiologists suggesting we should keep economies shut down for 18 months. And also, more importantly, on the way in which we are looking at the numbers the wrong way. And let me tell you a couple of key issues where I think we are looking at a very poor and limited data set on what's happening to the coronavirus outbreak. And because of the limitations of the data and the poor quality of the data, which are then fed into very sensitive forecast models, we risk to run into very serious misconceptions. So first of all, we all start from the assumption that whichever country you take, the outbreak started when we started measuring it. So we assume that whether it's Italy or the US or Germany, the virus arrived the day when we started looking for it. Further, we assume as we look at the number of new confirmed cases, which strongly depend on how many people we are testing and which people we are testing, we assume that instead the number of confirmed cases from day to day gives us a realistic representation on how quickly the virus is spreading, and that the mortality rate we get from those data gives us the true mortality rate. Now, none of that is true. We have no idea. We know that the virus originated in China in November, December. We can guess that sometime around January it arrived in most of our countries. We have no idea how many people are actually infected in each country, which in turn means we have no idea what is the share of people who actually need emergency room, intensive therapy, and the number of people who are dying. Now that's important because it informs the way we're looking at these numbers, that informs the policy reaction, which right now is crystallized in the decision to keep our economies in the US, in Italy, in the UK, and elsewhere almost completely shut. And the key question is, when can we start reopening them in a safe way? One additional point on this, Peter and Mick, which I think is interesting. Peter, you've shown me a clip, and people have seen on TV a clip of an example of emergent social unrest in southern Italy. And it's quite an impactful image of people who are actually in need of cash, and they're fighting with the police in the street.
They're almost like a month ahead of us or something. They're a little bit in the future in some ways.
And if you take it at face value, it's quite a dystopian future. So let's see if
this is scary for anybody who might be triggered by these things. But Peter, do you want to go ahead and play that clip?
Yeah, so this was one of the conversations we're having, Marco, is people are saying Italy is 8-10 days ahead of us. And that's pretty frightening. One of the points I think you made that we'll talk about in a moment is perhaps it's not all of Italy, it's a portion of Italy. It's back to the data business again. But here's a clip that comes in from Italy, and it's showing the beginning of civil unrest. It's exactly what happens when safety nets aren't there. There's no money, and as authorities try to enforce order, people who don't have money get upset. So here's this clip. It's a little bit disturbing, and then we can discuss it. And what was amazing about that is after some kind person on the street gave them 30 euros, she got even more upset at the government for its failure.
But here is something that I think is interesting, Peter. This is very dramatic footage. Now, it's topical also. You were mentioning one of the questions is Italy 1 week or 10 days ahead of the US? Is this what we're looking forward to? Yesterday in the White House press conference, the medical experts, Dr. Birx and Dr. Fauci, were saying that the model they were explaining is being used for the US or looked at to guide policy in the US is strongly informed by the Italian experience. But here's something interesting. I look at this clip and from the accent, you can clearly say, at least my Italian untrained ear tells me this is footage that comes from the south of Italy. I would place it probably in the region around Naples. Now, in Italy overall, there have been right now 110,000 confirmed cases of infection of coronavirus and over 13,000 deaths of coronavirus. These are the striking numbers that are getting everyone worried. However, in the entire region of Campania around Naples, there have been only 2,000 confirmed infections and less than 150 fatalities. If you look at Sicily, it's a similar situation, less than 100 fatalities and about 1,700 people infected. So the coronavirus medical crisis in the regions we've just been looking at is right now, at the moment, extremely limited. What you're looking at in that footage is the impact of the government shutdown of economic activity implemented to try to stop contagion, which is one of the reasons why I think it's important to think looking forward that the trade-off between the economic measures and the health risk. Let me make one point on this, and then we can move on to more straightforward economic issues, but still on the aspects of trying to understand the contagion. When I look at the Italian data, there is Lombardy and there is the rest of Italy. Lombardy has now a mortality rate of about 17%. The numbers are striking. The number of fatalities is over 7,000. It looks like the Italian Wuhan. The rest of Italy is much more in line with the rest of Europe so far. I also see that in Italy we had two simultaneous outbreaks at the very beginning, one in Lombardy, one in Veneto. Since then, the two regions have diverged completely. In Lombardy, the contagion has gotten out of control, causing a health crisis. In Veneto, it's been kept under control. The number of fatalities has been kept to less than 500 so far. And also, the last point on this, Miki and Peter, at the beginning of March, the government decided to shut down, to implement a lockdown, and to lock down in particular Lombardy and Milan. In typical Italian fashion, the decision was leaked to the press in advance. So in early March, you had thousands of people crowding onto trains and buses to go back from Lombardy, where they work, to the south, where they are from. It's been a month, and we haven't yet seen a corresponding outbreak, luckily, breaking up in the south. So there are some important question marks on the dynamics of this contagion, which I think we need to start factoring in thinking about how can we restart opening the economy. Because, and here we go back to the issue more at hand, which is what is the impact of all this on the economy? People are wondering and making comparisons. Is it going to be like the global financial crisis of 10 years ago? Is it going to be like the Great Depression of the 1930s? Is it going to be like the World War and the post-war reconstruction? Well, it very much depends on how long we keep the economy shut down, because so far, unlike those previous examples, we have not had an economic shock which was exogenous to the system. We have had a government decision to suddenly shut down large parts of an economy which was functioning extremely well and running at full employment. We've never done this before. Now, the damage depends, because if we can restart the economy over the next 4 weeks, and if the help which is coming from the government now is at least moderately effective, we can enter a recovery without first having a significant destruction of physical capital like you have in a war, or human capital like you have with prolonged unemployment during a financial crisis. If that is the case, I would argue the economic recovery could actually be quite quick and strong, given all the policy support from monetary policy and fiscal policy. If instead we have to keep the economy shut down for several months, then we will start having destruction of physical capital in the form of businesses going bankrupt and of human capital in the form of people remaining unemployed for a long period of time. And then coming out of it is going to be a lot longer, a lot more protracted, and a lot more difficult and painful. And as I said, part of it depends on how we read the numbers on the epidemics. Part of it also depends on whether or not the massive help which has already been launched or decreed by Congress and by the Federal Reserve, whether it will be effective. And to me, the question is whether it is executed fast enough. The help which is forthcoming is well designed. The question is, does it get to us fast enough?
So on a microeconomic basis, there are a number of firms that are based on events or people showing up that have very short operating capital threads, and I wonder about them. For example, the South by Southwest Festival was canceled. Its insurance didn't cover it, and I think they're effectively bankrupt. So, they could get a $500,000 loan from the government under the Small Business Project, but that might not bring them back. There's an awful lot of restaurants in San Francisco that may not be coming back, where the capital scatters. The Art Institute School here, which was was a nonprofit art school operating on kind of thin margins, but when they basically saw the spring and perhaps the fall semester go away, a government stimulus didn't seem to work for that. So one of the questions is, I just know a lot of people who are kind of in the events, music, conference, Burning Man, festival business. When I look at all of that, that seems like a sector that seems particularly fragile, and I'm just wondering if other sectors have that kind of fragility.
I would say definitely yes. When the events sector you mentioned is a case in point, large parts of the hospitality industry, you're relying on tourism, restaurants, parts of the retail sector. And let's remember also that together, the retail sector and the hospitality entertainment industry employ actually over 30 million people in the US. So that's a lot of jobs at risk. And you're seeing here a big difference between large corporations like General Electric or Boeing and small businesses, smaller businesses. Large corporations have a financial cushion that can carry them over a few months. Small businesses do not. Individuals do not. That is why the government has designed this help program, this fiscal stimulus program that is designed to get cash in the hands of individuals as quickly as possible and designed to give guaranteed loans and easy credit to businesses as quickly as possible. Now, the problem here is that as quickly as possible needs to be immediately, that is over the next couple of weeks, if not over the next week. And we know that government is rarely able to act very, very fast, but speed in this case, speed in the execution really is of the essence because we need to keep these businesses alive. Something you were saying, Peter, also suggests another layer of uncertainty. So businesses like retailers, restaurants, they now face two questions. One is, can I get help from the government quickly enough? And can I afford to pay the rent on my real estate, to pay my workers, or maybe decide to put them in unemployment for the time being so they can get unemployment benefits from the government, but can I stay alive for the next month and a half? The second question, though, is what happens afterwards? Because the help coming from the government has to be and will be temporary. Now, if you are a restaurant, for example, or an event planner, you also have to wonder, once the emergency is over, once the economy reopens for business, what will be different? Will people behave in the same way? If I have a restaurant, will people still be happy to come into my crowded and hopping restaurant as they did before? Will they do so already in June? Or is it going to be until June 2021 before they feel comfortable being in a crowded environment? And that's another big question that can have an impact on your decision today as to whether to fight to keep the business operational or not.
It's also, I mean, I think, as a small business owner myself back in the day, with Maya and I walked in every morning wondering, on some days during 2008, how do I not put a chain around the door? If suddenly the big companies aren't actually giving money to the small companies because they're frozen, they're sort of just wait. And a really small company is not a squeaky enough wheel in some ways to sort of get the attention of a big organization who's also looking out for themselves. And so I think there's a lot of need in some ways for some confidence that something's coming back from a movement standpoint. And also, who are the new people who are learning how to do things? How are we learning or even practicing our skills? A chef, anything else. If you're on the sideline for a while, you lose your tacit knowledge. So I just wonder, there's a lot of psychological dimensions to this. And, as an economist, where do you see this? Where do you see, the economic levers? Earlier, you talked about this challenge with, we're making a lot of assumptions based on not really good predictions and not very good. What can you bring us that might give us hope, or might give us just an idea of maybe how to think about this if we're a small business, if we're trying to do this, and you're running a small consultancy as well,
Yes,
right? So
yes.
I would be interested in what you're thinking, because I think a lot of people are both wanting to be courageous and look out for their staff, but they're also like, oh my gosh, am I going to be buried under a mountain of debt?
Absolutely. Let me make a couple of considerations, Mickey, that I think do offer hope and a note of optimism. And the first is that even though we are all worried about how dangerous this virus can be, and the government is rightly being cautious, however, as we look around the world, we see that there are parts of Italy like Veneto that I mentioned earlier, but also entire countries like Korea, which was one of the first to be affected, which have been able to bring contagion under control with much less intense limitations on economic activity. So we know it can be done. That doesn't mean we in the US should copy Korea today, but it does tell us that that can work. So we should look at it, and the administration will certainly be looking at it. The other part is what I mentioned earlier, which is that so far, it looks like there is very little in the numbers that supports the worst case projections we are seeing in the models. So there is every reason to believe that these social distancing measures are already having an effect. And the other thing I would say, Mickey, is that it's normal for the first policy reaction faced with the uncertainty we were discussing earlier, the fact that we know that at the local level, this virus can have a devastating impact on the healthcare system and can kill a lot of people. We've seen it. We know there is a lot of uncertainty in the data. So the first reaction from a policymaker perspective will naturally be to say, let me focus on the healthcare risk and let me just do as much as I can on that front. Then you switch to the current stage where you see that in the numbers, you see that the human impact of contagion is actually not going under control. The measures you've taken are helpful, but you also start feeling in a much more concrete way the pain of the economic measures you are taking. What we've seen before in the Italy TV footage, the fact that last week we saw all of a sudden 3.3 million people losing their jobs in 1 week in the US, which we've never seen before. So from a policy perspective, you start realizing that the economic pain is actually a very concrete and immediate need to address. You start thinking through the implications for the long term. Peter.
Does this become a public health / lives versus economic trade-off? Or is this if we speed up testing and have better data, we can be more targeted on where we do distancing and economic shutdowns so that we can bring back parts of the economy that are adjacent, and we believe we can prevent leakage so that the virus won't just pop up there? Follow that?
It's the second option, right? No, I think you're right, Peter. So I think the way out of here is to have a combination of more targeted containment measures. For example, realizing that different sections of the population are more at risk, whereas for other sections of the population, younger workers, for example, the risk exists, but it is manageable, and therefore it might be reasonable to get some of those sections of the population back to work quickly, while isolating sections of the population which are more at risk. It also involves a stronger effort on medical therapy, on finding cures, finding vaccines, and there is a lot of effort in the medical community, and I think it's excessively pessimistic to think that we will not get any advances on that front between now and the
Marco,
next
that is a
months.
perfect cue for us to bring in Susan Dentzer, who is one of America's top policy experts on medical policy and remote medicine. She comes to us from the Duke-Margolis Center. And Susan, we were going to go to you, but here we are, conversation, this policy conversation of trade-offs between economy and health. And if we had better health systems or better health data, could we accelerate and manage a better recovery?
And the answer to that is, of course, yes. And that's a big if and a big ask at this point. It's just axiomatic that we shut down the economy in so many places for health reasons, and that the only reason to open up the economy is going to be when we've got a clear signal for health reasons that it's time to open up. And frankly, here in the United States, particularly in the Northeast, we are a long way from that. If you think about the kinds of data that we will need to have for certain to know that it's quote unquote safe to ease social distancing measures, what are those data? Number one, what is the actual prevalence and incidence right now of the coronavirus and its presence in the community? Do we know that any place in the United States with any degree of specificity? No, we do not. We just know it's massive in New York. We know it's coming to it's massive here in Maryland, where I am at the moment. It's widespread. We don't know how much. Why do we not know? Because we do not yet have widespread, very widespread testing. So we don't know. We know a little bit about what the numerator is, who's showing up and testing positive in hospitals. We have no idea what the denominator is, right? How widespread is the virus throughout the population? Who's getting sick? So we don't know that at all. And we're not likely to know that here in the United States on any kind of a widespread basis for a few months. Okay, so that's number one. Number two, what would we want to know? Who's had it? Who's already gotten better? That's why we need what's serology testing, which means you're testing people's blood for antibodies. We're just getting some of those tests online and on stream. We have no platform for doing, at the moment, for doing widespread serological testing. So we have to create that. It doesn't exist currently. We have to create that. If we were able to do that, we would start to have a platforms for so-called surveillance capacity. And we would also want to link into electronic health records so that we could analyze other data and understand what did people have that wasn't maybe being classified as COVID that turns out really in retrospect was COVID. And we're also going to want to track that data as it accumulates, as more and more people become sick. So the sad and awful truth is we have none of that capacity up and running right now in the United States. So to think about when we could, with great comfort, give the all clear in a place like New York, who the hell knows?
You know, this is
what I'm hearing in this is probably an absolute requirement to be able to do the math in the all clear is massive testing. That is, you actually have to know what's going on. You need relatively real-time testing of people. You need antibody testing to understand if they're a good person for the workforce to go back in. So you actually need whatever that medical thing is, ramped up, inexpensive, all over the place, like a pregnancy test. And then you also need.
Right. Yeah. I've lost
a person.
Go ahead, Peter. I just lost your sound there briefly.
That I'm a trusted person and without violating privacy, right? In other words, if we send a population out and some people have a bracelet that says they're okay and some says they're not okay, I mean, that just has shades of every form of discrimination and World War II and, surveillance and insurance companies, everything else. So it's, this becomes that whole bit about how to use blockchain or trusted intermediaries or anonymity. So there's a long way of saying it sounds like there's an information system that's needed here of both a range of testing and a range of real-time results that would allow a city to hit the all clear. Is that kind of what we need?
Absolutely. And it starts with the widespread availability of tests, both the point of care tests for the presence of the virus that have now been FDA approved. So if we can make enough of them, we could get that out relatively soon. Then we also need the widespread development of the antibody testing and really availability of it and use of that, okay, on a massive scale to the degree the country has never done this amount of testing. Then we need to collect all of those data and synthesize all the data and begin to understand, okay, are there areas of the country where there is enough immunity potentially established by virtue of the serology testing, where we see the actual new incidence of disease going down. And then we could put together some kind of theory of the case that in this local area, it's probably okay for people, particularly designated groups of people, to go back to work. And I want to say one other thing, which is it is an illusion to think that there are elements of the population that we could give the all clear based on age, because that's not how it's working out in New York. There are as many people showing up and dying in their 30s and 40s as there are elderly people at the moment.
Can I make a quick point here? Just because I think something that Susan said is very, very interesting, and it highlights to me the trade-off we're facing. Peter, you were asking earlier, are we facing a trade-off between the health costs and the economic costs? I think the true trade-off we face is between the two kinds of uncertainty, the health uncertainty and the economic uncertainty. Susan is correctly pointing out that to be able to give the all clear, we need a whole lot more of statistically representative testing, much more widespread, and a lot more. And I completely agree, and that's hard, and that will take time. So the longer we wait and take tests and enforce social distancing, the more we will gradually acquire some certainty on the healthcare side and get closer to something close to the all clear. However, the longer we keep social distancing in place and the economy shut down, the more the economic uncertainty increases, and the greater the risk of tail-end scenarios, which are an incredibly deep, incredibly long recession in this country and globally, which will then have healthcare repercussions of its own. I think the trade-off between these two uncertainties is really the really hard part. And I see Susan nodding, so I'm hoping she doesn't disagree.
Absolutely. I think you absolutely nailed it, Marco. And, again, you think about a kind of a risk-benefit calculus that would be made, which is, right, what are the benefits of getting people back to work, and what are the risks that many people will die in that process because we haven't gotten this right? Who do we assign that responsibility for making that risk-benefit calculus? Our beloved federal government that we have so much great respect for. I don't mean to be overly cynical here, or does that reside in the United States at the state level? Is it localities? Those are really, really difficult
I hear
issues.
in this conversation, what do we do to apply resources? Two enormous design challenges. One is, how do we get that testing information system thing happening? And the other is really, how do you do scenario planning and just thinking through of the different ways people would make these economic real-time startup trade-offs? Because no one ever had a distributed problem like that before. On the former one, just a thought here, in our innovation, our tech community here in San Francisco and at places like Google X or XPRIZE, we often talk about moonshots. And one of the moonshots here is the vaccine or the ventilators. But what I'm hearing is, if you use the World War II analogy, this is almost more of an IT moonshot. This reminds me more of the invention of radar that helped save the war, or cracking the Enigma code at Bletchley Park, where a bunch of information scientists helped win the war, or the invention of Whirlwind, the world's first digital computer. That there is this concept of broad testing, broad universal information that flies up against all sorts of liberty and ownership and other rights in the U.S. But what I kind of am hearing is that's kind of an essential thing to get out of it. Or put differently, if you didn't have that, the likelihood that you'd start crawling out and fall back down up. So Susan, like, how is that going? Who's working on that? At least that's a technology problem that, you know, if you apply resources to, you can look at a per chart.
I want to inject here for a second. I think just to reframe that question just a little bit, Peter. You know, Susan, one of the things you've studied for a really long time is how long we've actually had telemedicine, or the ability to do this in a way that we can actually get people safe and cured, or at least on the path. Almost back to the 60s, I guess. In your research, we've had some of this capability. I think a part of the tech moonshot right here is how much do we actually have to do face-to-face in a big building that's called a hospital that can also give you all opportunistic infections, and how much can we actually use technology to lower those barriers or increase trust in things like telehealth. And that feels like I'd really love for you to spend a little more time talking about that.
Sure. And let me get to that, Mickey, in just a moment, but just to sort of tie up on the testing piece of it. So you think about, okay, so some of us are old enough to remember filing down to elementary schools to get our smallpox vaccinations when the smallpox vaccine came out, right? So you think about, okay, what would be the 2021 equivalent if you really wanted to deploy massive testing, not treatment at this point, because we don't have any effective treatments at the moment, but just on a testing basis. And this is way pre-vaccine. But what if we wanted to really do very widespread testing of individuals for actual presence of the virus with these new point of care tests, and testing for evidence of antibodies in the blood? Think about how you would stand up that testing capacity. You don't really want to a lot of people filing down to elementary schools to do that right now, right? Mm. So to the degree that you could create, send a little box to everybody in the country with these 2 tests in it, and then do maybe a telehealth consultation with a provider about here's how to administer the test. Now, you can't do that with the blood test yet, but maybe a self-administered blood test could be developed. So anyway, start to really think outside the box about how you disseminate very, very widespread testing, number one. But that would be a key piece of it. And I think, again, to tie this back to the data piece, it is the moonshot that would be required to basically gather all of these data, sort them, compare them across geographical areas, right? To understand, because as we know, this is going to be a rolling pandemic. It already is. It's rolling, from New York, it's going to roll up to New England, and obviously spread other places as well. So being able to compare what's going on in different geographical areas based on testing, that would be the optimum. So yes, a huge digital moonshot to create this. The Centers for Disease Control and Prevention has had for many years a system of tracking annual influenza, but it's very, very primitive relative to what we could build with a new system, a new fully digitally enabled data collection and data analysis system. So a moonshot to build that platform. And let's keep in mind, we're going to have a tiny, tiny window to do this effectively, because this does look like SARS-CoV-2. It does appear to be a seasonal virus. We're going to have this little window in July, August, where theoretically it will be in abeyance for seasonal reason. And then we're just going to gear up for the fall flu season, the fall pneumonia season, and the fall SARS-CoV-2 season redux. Right?
It seems too that the when it came back in 1918, it was actually much more virulent. The second time it came back, George Church was on a synthetic bio town hall this morning. Who's a synthetic biologist. He said the good news about COVID, if there's any good news in there, is it is unlike things like HIV and other things where it's high, it has a high mutation rate. It actually has a fairly low one. The problem is, a lot of people having it means that we could have one mutation that could have devastating effects. So it's a little bit more like getting, a flu vaccine or things like that, if we can get ahead of it. And we have, I think, 40 vaccines that are in the pipeline in some flavor of things, according to George Church. But the bigger thing is, as you're saying, how do we do like a care package and then test and then have a telehealth consultation and things? How do we think a little differently about inverting this, getting rid of everybody go in their car and drive over to the hospital and overwhelm the current facilities?
Yeah, exactly. And then just broadly, I mean, good old fashioned here and the now, what can we do in the meantime to counsel people who are either the worried well or people who are have early symptoms of what they think might be COVID-19, et cetera. We do know there's just been massive leaps forward in the last several weeks on the availability of telehealth, and beyond the availability, because the technology has never been the rate limiting factor on telehealth. Back in the 60s and early 70s at Massachusetts General Hospital in Boston, they were doing a really primitive version of telehealth between the main hospital and Logan Airport on these little tiny black and white television screens, right? So technology has never stood in the way of this. It's always been everything else. It's primarily the two big roadblocks to doing anything innovative in healthcare are always payment, who's going to pay for stuff, and regulation. Are you going to allow it to happen at all? And those two factors have stood so much in the way of telehealth up until very recently in very different ways. A lot of those barriers have been basically flattened during the public health emergency. There's much more availability of telehealth. There's much more payment. Both the commercial payers and the public payers like Medicare and Medicaid are allowing much more telehealth. So we have a lot of telehealth capability going on now. The real question is, a lot of the existing barriers have been suspended during the course of the public health emergency. What happens when the public health emergency is over? Do we go back to status quo ante, where we have all these barriers to telehealth, or do we say, okay, we just had massive proof of concept that we need more telehealth. Now it's time to really build the future of the virtual healthcare system alongside the platform of the in-person.
It seems too that these barriers, the doctor's not feeling like they could really do a good appointment, with somebody if they're remote, because they can't really sense them richly. The patient feeling like, am I really going to get a real doctor visit if I'm sitting at home? The payer, I think you said Medicare, wouldn't even cover any kind of healthcare in the home at some point from a regulation standpoint. So it's sort of like all that is being washed away at this moment.
Right.
And there are telehealth platforms. Who's doing the best job here, or who's a medical system that's really kind of that you're watching that was either prepared for this or has been pushing how this works, so that we're learning and actually trialing this stuff to find what we can do when we do get to the next level?
Well, the two best prepared healthcare systems in the U.S. to do this in the current environment were the ones that have geared up a lot of telehealth already. One on the private side is Kaiser Permanente, with 12 million enrollees across a number of states. And Kaiser last year, 60% of its total patient, quote unquote, visits were virtual visits. They were actually either telephone visits, they were emails, or they were video visits. 60%, right? So they had long ago broken that barrier that you have to have the patient right in the room in front of you, or you can't do anything effective for them. So they are very well positioned in the current crisis, and they also have massive video capability that they've created, and they've essentially basically institutionalized this so that everybody gets it. This is that you spend half your day doing this, or whatever portion of your day doing this, and your challenge is not how many patients did I see every day, but how many patients' problems did I solve today?
Ah,
And when
yeah.
you're framing it that way, then people get with the program, if you will. The other system that is very well positioned is the Veterans Administration, which made huge investments relative to the size of the system in telehealth, partly out of necessity. So many veterans live in more remote areas of the country where it's a pain in the neck for them to get access to the VA, even if they can even get an appointment. And we know the VA has had very well-known scandals around waiting times to see patients. Well, one of the ways the VA came forward to deal with that was to create a lot of telehealth capacity. And interestingly, the VA was not subject to some of the state laws and regulations that, for example, restricted whether you could do telehealth across state lines or not. If you're a private physician and you're in one state and you want to see a patient by telehealth in the second state, you have to have a license to practice medicine in that second state. The VA can get around all of that by virtue of being a nationwide governmental system. So the VA was extraordinarily well positioned, even in this crisis, to step in and do a lot of counseling of people via smartphones, iPads, et cetera, and again emerges as a kind of a model of how a system that is really living under one budget and has a lot of freedom to innovate can in fact innovate.
You mentioned when we were prepping for this call, you mentioned how machine learning was changing things with diabetic retinopathy. So actually technology making it, can you just give us a sentence or two on that? I know, time is getting shorter, but.
Sure, yeah. Well, so we're sort of as a nation, as a world, really, we're kind of at the tip of the iceberg in terms of bringing AI and machine learning technologies into healthcare. Most of it is now being done in various ways as a form of clinical decision support. So you're basically backstopping the clinical judgments that physicians and others are making. And the way you're doing it most visibly is through essentially any kind of a technology that is involved with images. So scans, CT scans, whatever, because machines are really good at looking at lots of different images, picking up patterns in those images, and being able to sort of synthesize, okay, if we see these images are different from those images, and we can see something's going wrong with the first set of images. So, mammography scans, whatever. Well, one of the devices, if you will, that's already on the market is made by a company called IDXDR. And this system was taught to look at scans of the retina in the back of the eye for signs of what's called diabetic retinopathy. So this is a condition that involves damage to the retina that can progress to blindness. And lots of people with diabetes get it. It's very often diagnosed only late. It has traditionally had to be diagnosed by a visit to an ophthalmologist. What this system does is basically it has been trained to spot signs of diabetic retinopathy. So you can actually hold a camera up to the eye of somebody who comes in for an appointment in a primary care doctor's office, scan the back of the eye, scan the retina, and essentially the system will basically alert whoever is using it that it does look like this person has signs of diabetic retinopathy, at which point the patient can then be referred directly to an ophthalmologist for care. So
this used to cost a lot of money, and it used to be very rare to be able to have. You had to go to a special place, and you had to have the right expertise. So it's almost collapsing the need for that expertise, at least in the screening or the diagnostics. Right. And I think that's where we have this evolution of new sensors, new machine learning. There is tech that's coming to play now that only now is sort of FDA approvable and can be used as kind of digital prescriptions for things and such.
Yeah, and we will from an investment in healthcare as time goes on.
Well, the other thing I'm hearing from an investment perspective here is that an awful lot of stuff that's possible, but that either investors or companies thought would take forever to get approved, or doctors or payers would not want to work at home, might happen. For example, when we were talking yesterday, you mentioned that the actual treatment for cancer can be delivered at home. So you go to a provider now. For example, in the U.S., we go to providers for dialysis, but many places do that at home. And so there seems like an awful lot of treatment devices that may come way down in cost to come into home and then become part of manufacturing engineering, both on the treatment and also you mentioned on the diagnosis bit. I was impressed when the Apple Watch included in it software that did heart monitoring, a fibrillation test. So that was like a whole sandbox with an FDA approval thing going through it as I was buying a $300 watch. Well, the more that can be built into consumer products. So I'd love you to speculate on that for a little bit, because this seems like one of these discontinuous phase changes in technology that we may see a lot of, where things are pent up.
Yeah, I think that's right. I think, again, back to the example of home dialysis. Hong Kong, 90% of patients get home dialysis. In the US, it's about 10%.
Wow.
Patients getting home dialysis, and we're slowly building a new infrastructure to move more to home dialysis, but I think that this whole notion of distributed care, of care moving outside of institutions, and I will just do a brief commercial for this report that I was a co-author of, Healthcare Without Walls, which is still available on Amazon, is basically creates this vision of a system that is really moving, where possible, closer to individuals in their homes and communities, by virtue largely of the technology, but also to address growing desire for convenience. It's clearly much more convenient for people to get home dialysis than it is to go to any kind of a center to do that. So the combination of the technological capacity to do these things differently now, the increasing ability to do them with smart devices and in smart ways, and link back to providers for data analysis, et cetera, as well as the desire for convenience. I mean, all of this is coming together to really create these new capacities to really push care to a more distributed.
This goes almost to what Marco was saying about sort of what will happen at the other side. Will we have put things in place so that we don't, snap back to the old way of doing things? It sounds like a lot of what you're doing at the Duke-Margolis Center is around what are the policies? How do we learn now in this forced experiment that we should carry forward? And what are things that were just an emergency? Like, okay,
Right.
We relaxed those too soon. Peter, I know you're trying to probably at the point of the hour, we'll probably go into overtime a little bit, but and Marco, what's your reaction to all this?
Yes, I was at the point where I was actually going to bring Marco in, but you were right there, because Marco, when you were at GE for years, here's a business with an enormous medical system, healthcare practice, but also it was not an easy place to drive innovation. So as you're listening to this, what's your sense for the degree to which industry and industrial healthcare people might start seizing this new opportunity? How does that begin to happen? Certainly be a great perspective here.
I think it's a very important and potentially very positive shock to the system, as we're hearing from some of the things Susan is mentioning, because it's a point in time where we see how vitally important innovation can be, the ability to do things faster, in a more flexible way, in a more distributed way. Now, the problem is large corporations, as you mentioned, Peter, they're hungry to create innovation. They also find it very hard to move away from the structure, the bureaucracy infrastructure that is very important, crucial to keep in place safe and reliable processes, is also also a very, very heavy burden for anybody who wants to move fast and break things and innovate. But I think if I look forward, I would say that two considerations on this. One, I believe this crisis will show that the ability to move fast, to do things differently, to pivot from producing car engines to producing ventilators for hospital is critically important and will be valued more, will be factored in more into business decisions, investment decisions, and hopefully also into decisions about regulation. The second,
I wonder if it's creating a new mythology inside of some of these large organizations. They're like, hey, we just did that. We just converted Under Armour to making things.
Yeah.
And I think, a lot of big organizations run on mythology. They run on that sort of, this is what we can do, or this is what we can't do. And it limits them too. And it sounds like that's what you're saying, and to some extent, is how do we build better mythologies and about what's possible? And then how do we build capacity? Right now, we design factories as if it's really hard to change a factory. It might take me 9 months to change a factory line. How do we design factories as if we don't know what we'll make tomorrow? How might we enlist a very different sort of a generative design approach to say we need to be prepared for uncertainty? This is an uncertain world.
I think that's absolutely right. And it's something, the generative design and the structuring of the workplace is something we've discussed together before, Mickey. I think it's crucially important, and you're right. In large companies, this will create a new mythology where CEOs will be able to talk to their workforce and say, see, we did this. We can do this. And therefore, let's work on being better prepared to do a similar thing. On the almost a mirror image, if I look at the startup world, the tech world, I think on the one hand, this is a boost to their ego because it highlights the importance of innovation. On the other side, it's a reality check because we've heard for a number of years over the magic promise of healthcare innovation. And now we're not there yet. Now we find out in a very painful way that very important progress has been made, is being made, but compared to the urgency of the situation, we should be able to move a little bit faster. The third element I would suggest, Mickey, which is going to be important, is we know that innovation needs cooperation and collaboration. However, and collaboration ideally would be on a global scale. However, what we're seeing now is a very strategic use of geopolitical resources. We're seeing governments hoarding their own medical supplies, hoarding their own knowledge, cutting trade, cutting the flow of people. In the case of China, even threatening the US supply of components for the pharmaceutical industry. So we're finding out that when it comes to the crunch, perhaps as a country, you do want to be a bit more self-sufficient, and figuring out how we leverage technologies, whether it's generative design, the distributed potential of 3D printing, to try to have national economies which can flexibly open themselves to global collaboration, but at the same time be able to circle back and be more self-sufficient, I think is going to be another important theme.
I mean, this is a pattern from nature that we learn the hard way sometimes, is that nature abhors a singleton, right? If we have one place where the system can fail, it can really take us down. And we kind of learned that maybe from the economy in 2008. 100 people between New York and London came up with a crazy idea, default swap derivatives, and it took down a non-redundant system. So how do we have more redundancy in the system? How do we have more self-sufficiency, the sort of micro localization? I did hear from Ting, who was on our show last Friday. She is from China, and she has a large family there, and is interacting there as well as here from the Duke Center for Advanced Hindsight. And she said that the Chinese government was actually encouraging, through barcodes and through QR codes and stuff like that, in local places that were coming back from the virus, and also digitally on their mobile platforms for buying things, encouraging people in larger communities to actually buy from small villages and from small groups that are making things, rather than buying like the big generic thing. And it was a sort of a hard push at a government level to say, buy locally. And it feels like, I mean, that's a part of what I hope is going to happen in the United States as well, is how do we actually look at a 5-mile radius and say, wow, what could we do here that would actually support right here? And what could everybody do that way, rather than believing that they need to get it, via the other side of the planet?
okay, it's quite possible that we're back. And what we think happened was the crash of StreamYard, the streaming tool. I want to point out that we always crash right after Mickey brings up the need for resilience and the fact that nature abhors a single. Marco, are you there?
I'm here. Yes.
You must be there. Okay. So
I'm here.
It is interesting. Yeah. So I believe StreamYard crashed. What we will probably don't have a lot of people viewing right now because this is what happened. Crash. But interesting to talk about is hello everybody. We've just come back from a system crash. That is to say, the streaming technology that we're using, that its server crashed. Its server crashed probably because this technology is being stressed like it hasn't been stressed before. This came up. Mickey once again brought up the fact that nature abhors a single point of failure. I want to bring in our friend Mohib. Mohib, are you there? Mohib Zara, who is our kind of a lead technical person. Mohib and I met on the internet about 10 days ago when we were creating this and he was creating quarantine streams in which you expressed an interest in what are all of the things that can be streamed, dance parties, ambient material. Just you were kind of sitting in there inventing media, and you professionally you work with a big web services provider. What have you been seeing, both in terms of new uses of this, but also in terms of vulnerability?
Yeah, so there's been, a lot. Can you hear me all right?
Yes, we can actually hear you. Technology is back.
All right. Yeah, there's, people are, again, trying to fill the void of all that free time and that lack of, social interaction. So people are streaming a lot more than ever. I think, a lot of us probably at some point or another scoffed or laughed at the people who, regularly would do TikToks and Snapchats of them making breakfast, and kind of back when Twitter first came out and everybody scoffed at anybody who posted a picture of food. Now it's like, oh, you know what? Please do that. We need that. We want to see people are still living their lives. Yes, the quarantine is not great. It's hard being so isolated. And while there
was something about this media moment. Yeah.
Okay.
Something about that kind of requires or pulls for togetherness and looking over each other's, is to say, because we're so isolated, you really do want to know, you want to watch TV shows together. You want to share how people are cooking. It's a water cooler moment, even though we're not going. Last night or this week, but from at home. So you and I were both commenting that we were watching Colbert last night, Stephen Colbert. And Colbert made a whole bunch about Zoom not working, audio failing, all the crap that we just went through. He did a whole segment with the guy from
Tony Reckel.
Yeah, right, exactly. In which nothing was said for 10 minutes because they were gesturing, trying to get the sound to work, right? So that I thought that was an interesting moment. This is a good time to bring up that I just want to throw some nods and stuff. Marco, can you stick around for a few minutes? So
yeah,
what I thought we would do is do one more. Yes. I thought we'd do one more segment, officially end the show. And
there's something odd with the audio, Peter. I don't know if it's only me. I don't know if it's only me, but I can hear a double audio overlapping, the current one plus the previous one.
Yeah, not sure if someone, if Peter, you or anyone have another window open or another computer going with audio. We're hearing a little faint echo in the background of someone time delayed.
Yes,
I'm barely on the internet
thinking,
now, so
is that better?
Yes.
The latest thinking, Marco, from complexity theory, string theory really, is that we live in parallel universes. And these rarely combine. But when they do, you hear multiple streams at once. That was just a remarkable
We just had proof.
moment.
We just had proof. Yes.
Will be coming shortly. Okay, we've been talking about different uses of media, and in today's show, we talked about structural changes, permanent changes we might see in the economy and in healthcare. Another arena that is clearly getting shaken up right now is television. First of all, people are just watching a lot of it. If you were a TV executive and you wondered, what would it be like if everybody had to watch TV all day long? Now is your big moment. But then you also have this moment where the technology is changing and it's a lot less. So in preparing for today's show, we talked to a third guest, Ted Linhart, who is a Senior Vice-President of Research at NBC Universal Comcast, who has been watching all of. And I was especially excited this week because it also turns out he's my brother. So why don't we roll this segment and take a look at how the world of TV is changing, viewing habits are changing, and how television itself is turning this into a giant experiment, though they're not exactly sure, but they're that all the data is coming in. Mohib, can we roll that? I'm speaking with Ted Linhart, who is a Senior Vice President of Research for NBC Universal. He has a perch inside one of our largest networks at a time of amazing change in media habits. Ted, I've known you throughout your life, and you've been watching media use kind of ever since you were a kid.
Yes, there's a pretty good reason you've watched me throughout my life.
And that's because I'm your brother. Yeah. And in fact, when I was a kid, I would watch you watching TV, and then you started a blog on TV. We've both been interested in media, and now you've ended up at NBC. So the question really is, you watch very closely audience research, audience behavior, and now everybody's at home. So what's changing? What are people watching? How much more are they watching? And are the kinds of things that interest people changing because we've changed?
So we've been looking at media trends for years, and for traditional television, we've been seeing viewing levels go down for the past few years. As people go to the internet or cut the cord, every year viewing goes down. But in the last 2 weeks, we are now seeing each day viewing is up year over year, which we've not seen for a long time. When we drill down into that more, we're seeing that that's really coming from people between 10 a.m. and 6 p.m. Those hours are the hours that are up a lot year over year, sometimes 40, 50% higher than they were a year ago, where in the past we've seen levels down 10 or 20%. Prime time is actually fairly flat for traditional TV because those people have been home in the past. So we've seen a huge increase in daytime viewing. We've also seen some shows in prime time up still year over year, even if all viewing isn't necessarily changing. The content that we think people are watching the most outside of news, which of course is up a lot year over year, I've seen two different types of content resonate in the last 2 weeks. One is trusted content that people know based on some sort of IP. So this includes things like Law and Order or Chicago PD or Harry Potter movies, things that people can put on if they're airing as a marathon. They know they don't have to change the channel, and it will entertain them or distract them or be background noise for the entire day. That's one piece. The other piece is what I call focused distraction. Networks that provide a specific focus of content, like cooking or home and garden repair, or family movies, or wholesome movies like Hallmark Channel, that are distraction from world events. The content inside of them do not talk about world events, so they're focused on a specific genre of content, and they're a distraction. And those networks are up more than other networks are up year over year. Right now, almost all cable networks are up. The ones that seem to me to be up more than the rest are the ones that are providing very specific, doesn't have to be very specific, but specific content that airs all day, and that is a distraction.
You mentioned that things like Hallmark Channel, which I guess has a niche audience, which other things are just popping up and surprise you?
So in addition to our channels, which are all up a lot because of the first bucket of content like Harry Potter and Law and Order, networks like Lifetime Movie Network, which has a huge library of silly women in jeopardy campy movies that can easily be left on all day because they just air nonstop and are a lot of fun and, completely separated from world events. HGTV, Food Network, Inspiration Channel is another channel like Hallmark that provides a lot of wholesome content. Those are the type of Freeform is the old ABC Family channel that airs a lot of family movies. Those are up a lot because it's something the whole family can watch together. So those are some of the channels we've seen perform better than others. But again, almost every channel is up at the moment versus last year.
And what's winning now? Is streaming winning because people are doing on demand or Netflix, or are people just turning on cable because it's there?
So everyone's winning right now. Streaming is definitely up more. So streaming year over year has been up 20, 30%. Now we're seeing them up 60, 80%. So people are definitely watching a lot more Netflix than they were. They're also watching a lot more cable. We looked at so Nielsen's able to track what people are watching on Netflix on a TV set. And for the first week that everyone was quarantined, we were able to see there was a wide range of content being watched. There was the Mark Wahlberg movie called Spencer Confidential. There's this documentary called Tiger King. The old movie Outbreak from 1995 about a pandemic people were watching. There's a movie called C.J. Walker about the world's first self-made female millionaire. She was an African-American hair pioneer. We're seeing a wide range of content on Netflix doing well. There's not a specific trend. It seems like it's every week we see content on Netflix that's new pop.
Hey, can I ask you a question about Netflix?
Yes.
The number one show on Netflix right now is this crazy show about the lion tamer.
Tiger King, yes.
What the heck is that all about?
I've watched all of it. It's hard to explain. It's about a guy who collected tigers and ran a tiger zoo.
Yeah.
And he's just a very, very wacky guy
I've watched it. I know what it's about. My question is, why is that the most popular thing on television?
So Netflix this happens with Netflix from time to time when people really are into it. They binge it. It's wacky. It's discussable. It's bingeable. It's water cooler content. And we see with Netflix that random unscripted shows that are just about eccentric characters or heightened events can succeed. Before this, there was a show called Love is Blind on Netflix that was doing very well for them. I think a lot of what pops on Netflix is because they can put all their energy behind it, and you have a captive audience literally now and 60 million subscribers. So it doesn't probably take a lot. And people really like different types of unscripted content about bizarre characters. It's hard. I don't have a better explanation except that everyone tried it and they liked it.
So TV is up. What's going on with advertisers in all of this?
From what I hear and read, many are wanting out and, not putting their money in TV for now. There's other people who are maybe coming in or staying in, but the ad market, from what I understand, is down, and people are trying to figure out, can they move? Do they have to give money back? Things like that.
And with the exception of news, which is always about this, is there ever any other programming that has kind of a short turnaround production schedule where the programming itself is beginning to adapt to this?
Yes, talk shows. So last night was the first night that basically all the talk shows were back on the air. Jimmy Kimmel, Stephen Colbert, Jimmy Fallon, Andy Cohen, Conan O'Brien. They all went back on the air with shows recorded from their homes that other staff members are editing and putting together from their homes. So so all the talk shows are back on the air, and I believe they plan to be until they go back to the studio.
And I kind of asked this because here we are sitting with a distributed workflow, basically TV show where I'm interviewing you for a segment and we go live. There's one guy who's director in one place and people in other places. So are people just using all sorts of new tools to basically cobble this together with the same web tools people have?
Yes. I don't know how new the tools are, but I'm guessing they putting them to use that as they never had thought they would before from their homes. So it will be interesting to see how this affects, if it affects production when everyone goes back. Do people realize they don't need as much of an elaborate production? Or will they be so happy to get back to the studio and realize that that's really the way a show should be, that it won't change anything, which is probably my guess. That I'm not sure how much will change when things change, when things revert back.
And the final question, as a research guy, I mean, researchers always want to run experiments and model things. How are you guys using this as like a big social experiment or audience experiment, in addition to just responding to the fact that everybody's at home?
We don't quite know yet. We're certainly, as researchers, this is an amazing opportunity to understand what if, we always say, what if everyone had to stay home and watch TV? What would happen? Well, it's actually happening. I think we're trying to learn what do people gravitate towards when they're forced to watch TV, and how does that inform our scheduling strategies? Because we still have to schedule linear networks moving forward. What does it say about the value of promotion, the value of stunting, the value of certain repeat content that maybe now is being discovered? And is someone going to discover a piece of content they hadn't really watched now? And when life goes back to normal, will they stay with it? Maybe they will, and maybe that's something we can encourage them to do. So it's a little early to know how we're going to use this. And I think by the time it's over, we'll have enough data to try things that we might not have thought of trying before.
Ted, thank you. I'm glad that you and I grew up as brothers watching television, and you've put this to use to completely help us understand what's going on right now. And I'm sure we can share this with Mom, because she's at home watching television as well.
Yes, only one channel though, CNN.
That's right. Mother just watches the news.
Yeah.
And we have to remind her that there's an entertainment world there. Thanks, Ted, and thanks for your insights at NBC Universal.
Thank you.
Let's get close, but not so
Music. Hey, so actually, Peter's Comcast people just showed up because I guess, Peter, you've got to actually get that internet thing working. I had a question, maybe last one, and we'll wrap up. John Soltis, who is in the live comments, said it was actually a question for Marco. Because large companies are better positioned to survive, does it mean we're going to come out of this with a greater gap between the haves and the have-nots? Is this going to spur more populism? Is this where does that all go, or where do you see it going from a macroeconomic perspective?
So these days, sadly, everything seems to spur more populism. But I think it's an excellent question, because we will see some unanticipated changes going forward. First of all, I did mention large corporates are in a better financial position to weather the storm. Short term, however, many of them will be severely hit, especially if, as we were hearing from Susan, we might need to prolong the economic shutdown for longer, which means that the large corporates will need bailouts, they will need significant long-term help from the government, which means they might end up under more significant government influence than before. And we've heard talk already about the government possibly taking equity stakes in large companies where it provides help. Conversely, I think on the small businesses side, fewer might survive. We might see a higher incidence of bankruptcies, but I think those that survive will be a lot faster, a lot more resilient and adaptable, and in a much better competitive position to move forward. And then finally, Mickey, there is the point you made earlier, which is we will probably realize now that we need, on a long-term basis, a more resilient system, and therefore probably a more distributed system, which also needs a lot more smaller components to it.
Yeah, and I think let's probably aim towards wrapping up now. We've had our own joy of resiliency, right? Of course, when I say resilience, the internet fails on us. I think it was a bunch of cats tangled up in the internet somewhere. But I do think, I've seen some interesting startups out there. Like at CES last year, there was one that I've become friends with and learned a little bit more about. That's called Wilkinson's Bread Baking Company, and what they did was they made these kind of robot machines. They look like a kiosk, and they were bringing them into local grocery stores. And they were doctors actually originally. They've been serial entrepreneurs for a number of generations, and they really worried that the basic food, like our basic staples like bread, have so much preservatives in them and are so unhealthy, and often are like pre-baked, frozen for like a year, even at places that you might imagine you're getting fresh bread at, and then warmed up at the end. And so they said, could we build kind of a network of bread bots that would be local, it would smell fresh, it was baked every day. And what they noticed was it delivered something like 30 or 40 up to 50% better margins for the local grocers, because they weren't paying for this stuff sitting in a warehouse, being manufactured over there, had to be made to last in a warehouse for a long time and all that. And it was kind of this distributed micro factory for bread. And you could imagine that turning into a new kind of a network. Ted was talking about how the Food Network's there. But what if you had like local chefs who made cool things out of bread who could be published to the local grocer, and for this week only, like you can actually try out some new things. And so there's a lot going on in what people have called the reconfigurable micro factory movement. And I think that's the tech side, but I think it's also just how do we celebrate people who have wonderful small businesses, and not think every business has to metastasize into the next Google or the next whatever that has been turned into sort of a fetish for startups. I know the Kauffman Foundation has said in their studies of entrepreneurship across the United States and probably in other locales as well, that the average age of a successful startup over time, the average age of the founder is about 40, not 23. But we've turned it into kind of a hero worship celebrity thing. So hopefully this is redirecting us to people who just do wonderful stuff, local small businesses, Main Street businesses, because we do have to keep an eye on that. And if we can, let's all go out, and when we can go out or remotely, locally, order and support local businesses. We're going to need that. Thank you so much, Marco. You and I have played around for a while now and bounced ideas off each other, and it was really fun to have you on today. Peter's dealing with cable issues. I think what we're going to do is tell you that this Friday we're going to have another episode at 4:00 Pacific time. And Fridays are for the future. So we often try to say, let's step back and look farther out into the future. We're going to have some interesting guests this Friday. And this is a community as well. So join the streams, join the things, and take a look at what we can do when we get off of our screens and get out into the world. Thank you so much, Marco.
Thank you, Mickey. Thank you.
And yeah, let's go to credits if we can, Mohib. I don't know if you can run that now. Perfect.
Let's get close, but not so close. Quarantine. You can share from a distance. Quarantine. We want to see each other. We'll have to stay in your quarantine space while we talk.